Welcome to Library's Lunch and Learn session on Nursing Reference Center. The Lunch and Learns are an ongoing series of mini lectures on a variety of research-based topics and databases. Please check the Lunch and Learn page at library.rrc.ca for more information. Let's get started. Nursing Reference Center is the premier evidence-based information resource designed specifically for nurses. It improves quality outcomes, answers clinical questions, improves nursing skills, and supports nursing research. It contains nearly 4,000 evidence-based care sheets and quick lessons, more than 2,300 nursing skills and skill competency checklists, as well as numerous cultural competency sheets. Nursing Reference Center is an EBSCOhost product and is closely related to CINAHL Database, which is the Cumulative Index of Nursing and Allied Health database, in that it also contains CINAHL articles. Nursing Reference Center has a lot to offer to nurses, nursing students, and faculty, including quick lessons, evidence-based care sheets, 2 drug guides, as well as full-text ebooks. NRC is geared specifically towards nurses, as opposed to UpToDate, which is geared towards physicians. This is the landing homepage for NRC. In this session, we will be exploring the various purple tabs across the top of the page. That is, diseases and conditions, skills and procedures, drug information, patient education, and practice resources. We will not be exploring the continuing education, as that pertains more to nursing in the United States. The spotlight area on the left of your screen highlights resources of interest within NRC and gives the editorial policies of NRC. The Nursing Procedures section gives quick links to new procedure sheet. And at the very bottom of your screen, you can click the link to receive instructions on how to install NRC on your iPhone or iPod. On the Diseases and Conditions tab, you can search disease or condition to get clinically organized nursing overviews designed to map the nursing workflow. In this example, we are looking for information on treatment adherence for a patient with COPD. There is an evidence-based care sheet for this topic. Simply enter COPD and select the appropriate topic. Evidence-based care sheets are great, usable, concise information with the subtopics of what we know, what we can do, what we can tell the family, as well as other references which you may want to explore further. Once you have located an evidence-based care sheet, you can print, email, or save to file or folder just as you would in CINAHL Database. Saving to folder is only good for the current session unless you have created an account within EBSCOhost and have signed in as yourself. You can use the same account for all EBSCOhost products to keep items in your folder permanently. Alternatively, you can email the item to yourself, and that would give you the resource in the PDF format. It would give you the permalink, as well as a citation in APA format. It is very important to watch your capitalization in the EBSCOhost citation. This citation is still in the 6th edition of APA. In the 7th edition, it is no longer necessary to include the phrase retrieved from. With any online citation tool, it is important to refer back to the Administering the Right Care style guide, which was provided to you when you began your program. This document contains very good examples which you can refer to for any clinical or for any citation questions. On the Skills and Procedure tab, you can search for a topic by entering a keyword or by browsing the alphabetical heading list. Included are clinical papers detailing the steps to achieve proficiency in a specific task, including checklists. There are also cultural competency documents which may be helpful when dealing with patients from a variety of cultural backgrounds. The Drug Information tab contains 2 drug guides, both of which are American-based. The first is the Davis Drug Guide for Nurses, and the second is the AHFS Drug Information Essentials. Both resources are searchable by either entering a drug name or by scrolling through the alphabetical list. In this example, the drug salmeterol has been selected. You will be able to access a pharmacological profile of the drug, adverse drug reactions and side effects, and nursing implications as shown here in the table of contents on the left-hand side of the page. Patient education sheets can be searched by keyword or by topic and can be browsed by scrolling through the alphabetical list. Patient handout sheets are evidence-based and are available in English and Spanish, which may be helpful to you. They are in easy-to-read format for the patient and may contain detailed medical illustrations, definitions, causes, treatment information, etc. In this example of a patient education sheet on breast cancer in women, there is information for the patient on the various imaging tests. Tests like mammography, CT scan, and PET scan are all hyperlinked and clickable for further information. Under the Practice Resource tab, there are several manuals or ebooks that are available to you in full text, including the Davis Drug Guide, the Tabor Cyclopedic Medical Dictionary, and Davis's Comprehensive Handbook of Laboratory and Diagnostic Tests with Nursing Implications. Other titles available to you are Psych Notes, Understanding Medical Surgical Nursing, Nursing Care Plans, and Nursing Diagnosis Manual. For example, the full text of the Medical Surgical 5th edition is available by clicking on the book cover icon and then by clicking on any of the individual chapters or by searching within the publication for your specific topic. And finally, the Nursing Reference Center app can be downloaded to your iPhone or iPad at the URL on the bottom of your screen. If you have any questions, please don't hesitate to contact us. You can contact the facilitator of this presentation by email or go to the library homepage and click the Ask Us button to open a chat with the reference desk staff. Thank you for attending. Please check out our webpage for more information about other Lunch and Learn sessions. New web videos will be added weekly. Live presentations should continue in the fall of 2020. How did we do? We thank you for your attendance at this session. If you haven't done so already, please fill out our quick survey using the following link: bit.ly/RRC_evaluation. We appreciate your feedback. Have a great day. Please send your questions, comments, and feedback about the Lunch and Learn program to rwoodby@rrc.ca. Thank you.